Hello, I'm Dr. Maury Markman from City of Hope. And in this final segment of Minutes with Markman, dealing with the ESMO meeting that just concluded recently in Berlin, I wanted to end with the final overall survival results of a very important study, which was reported at ESMO. Again, to emphasize both the importance of this meeting, the importance of the studies, the quality of the studies, and the impact the studies and the data presented have on our patients that we care for on a daily basis. So this paper was entitled Final Overall Survival and the Association of Pathological Outcomes with Event-Free Survival in Matterhorn, a randomized phase 3 study of durvalumab plus 5-fluorouracil, leucovorin, oxaliplatin, and docetaxel in resectable gastric gastroesophageal junction adenocarcinoma. The results of this study have been reported over time, progression-free survival, earlier studies demonstrating the benefit. But this particular study looked at the final impact of the strategy on overall survival in this difficult clinical setting. And clearly, overall survival here is the most meaningful endpoint. So this was a global study that looked at the use of durvalumab plus FLOT, F-L-O-T, and it demonstrated significantly significantly improved event-free survival versus placebo in earlier studies. Evidence has suggested that pathological response and downstaging, because this included neoadjuvant therapy, were associated with improved survival in patients with gastric cancer. And in this study, they were reporting the overall final results in the intention to treat population. Again, the data has previously been presented, but this was a extremely well-designed study conducted in a meticulous manner. Gastric esophageal junction adenocarcinoma, again, previously specified the details of the population and stratification factors. Patients were randomized 1-to-1 to receive neoadjuvant durvalumab or placebo plus FLOT, the chemotherapy. Everybody got the chemotherapy for 2 cycles. Then again, this was a neoadjuvant study. They underwent surgery unless they were not able to for some reason. They then received 2 additional cycles of durvalumab flat or placebo and flat, and then a maintenance strategy of durvalumab or placebo after this. The primary endpoint was event-free survival, with the secondary endpoints in this study being overall survival and the pathological complete response rate. Bottom line here was durvalumab plus FLOT demonstrated a statistically significant and clinically meaningful improvement in overall survival versus FLOT alone in the intention to treat population, with a hazard ratio of 0.78, p-value of 0.021. Put this in perspective in terms of percent survival. At 3 years, 68.6% of patients who received the checkpoint inhibitor were alive, compared to 61.9% who did not receive this agent, a 6.7% difference in overall survival at 3 years. Clearly, in my opinion, this is a meaningful outcome for patients with this very difficult condition. Interestingly, the durvalumab plus FLOT compared to placebo and FLOT improved overall survival regardless of the PD-L1 status. We actually know that this is a tumor marker that may be relevant in some tumors, but not terribly relevant, if at all, in others. Again, interestingly, any degree of a pathological response was associated with improved event-free survival with the use of the durvalumab. And event-free survival was improved regardless of the pathologic nodal status. And finally, the authors concluded, and I agree with this conclusion, that Matterhorn overall survival results strongly support preoperative durvalumab plus FLOT as they use the term new global standard of care for patients with localized gastric or gastric esophageal junction adenocarcinoma. Those are strong words. Obviously, we're talking about agents that are expensive, certainly the immunotherapeutic agents, and we are talking about a global conclusion. But I think the data speaks for itself, and for patients, this is a drug strategy that clearly has improved outcome. And in this situation, we're talking about overall survival. And I thank you for your attention.